For several weeks, Jason Kenney has been sleepwalking into the second wave of the COVID-19 pandemic. He's failed to act. Even though the warning signs of surging case numbers, hospital outbreaks, and canceled surgeries are obvious to all Albertans. And today we can hear the alarm bells ringing even louder. More than 600 new cases, almost 8,000 active cases, and a growing threat to our hospital capacity. More than 70 doctors, including some with senior AHS roles, wrote to the Premier today and warned him, quote, if this rate of increase continues unabated, our acute care health system will be overrun in the near future. This letter comes only 72 hours after we heard Jason Kenney downplay the risk of COVID-19, as we've heard him do before, and dismiss it as only the 11th leading cause of death in Alberta. We heard the Premier tell the legislature last week that our contact tracing system was working fine. And then the next day, Dr. Hinshaw told us it was in fact overwhelmed. I'm deeply worried that our political leadership and our medical leadership are not on the same page. I'm also very concerned that the Premier claims that there has been no new modeling of this pandemic since the spring. Statistical modeling of infectious diseases is a core function of public health. I'm confident, for example, that Dr. Hinshaw's team is looking at modeling right now for influenza. If the Premier says there is no new modeling of COVID-19, then maybe he's simply concealing this information from Albertans, or maybe he's directed Dr. Hinshaw to stop doing that work. But Albertans deserve a clear answer about the methods that Dr. Hinshaw and her team have available to forecast the spread of COVID-19. Let me be clear, the Alberta NDP does not want a full economic shutdown. But we do want the government to take additional steps immediately. We've presented Jason Kenney with 6 non-restrictive measures that he could take to reduce the spread of infection. Measures that should have been in place, frankly, weeks ago. The window of opportunity to prevent harm to our economy, to our small businesses, our livelihoods is closing. And if we reach a point where our acute health care system is overrun and the province is compelled into a lockdown, Albertans will look back at October and November and ask if everything that could have been done was done. And as of today, sadly, the answer to that question is no. I think what's important to recognize is that those decisions that have been made in other jurisdictions have been made based on the evidence and based on the data that was collected. And one of the issues that we have here in the province of Alberta is we have a significant number of contacts that cannot be traced. We have a significant number of cases where we do not know the source and we do not know entirely who those individuals may have been in contact with. That is why it is so incredibly important that we up the number of contact tracers so that we can do proper contact tracing. But secondly, it is also incredibly important that the Premier stop downplaying the seriousness of COVID-19. We saw him in the spring intentionally, repeatedly refer to this as an influenza on the floor of the legislature. We saw him recently dismiss it, saying it's only the 11th leading cause of death in Canada. So this Premier, if he wants to be taken seriously, and he indeed wants Albertans to take personal responsibility, he needs to show that he views this pandemic with the true gravity and respect that it deserves.